So a lot of what the nurse has to do can be done on mom. And we like to try to leave you be for that first hour or until the completion of the first breastfeeding and not really do anything except for assign APGAR scores. So these APGAR scores are given at 1 minute and at 5 minutes. And it tells us the overall transition that baby is doing, like how well that transition's going for your newborn. And so we are measuring 5 different things, APGAR, okay? So the first thing, the A, stands for appearance. What does the baby's skin color look like? Now, it's not uncommon for newborns to come out blue or purple looking. That is not very uncommon. And remember, this first score is given at 1 minute of age because at delivery itself isn't enough. We need to give the baby time to come out, get the blood from the cord, and do its breathing, right? The P is for pulse. What does the baby's heart rate doing? Is it below 100, above 100, or is it not present at all? The G is for grimace. So with the grimace, we want them to have a reflex to what we're doing. So if we're drying them off, we want them to kind of move in response to that. If they're really floppy, that's a concern. The next A stands for muscle tone. So is the baby flexed like this? Are they bringing their arms up and their legs up? This muscle tone is important. And then the last R is respiratory effort. Are they breathing? Are they breathing on their own? Or are they grunting? Or are they not breathing at all? So we give a score for all 5 of those. Normally, a baby's APGAR scores are between 7 and 10 at birth. Now, I don't really believe there's very many true 10s because most babies will have acrocyanosis. Acrocyanosis is when their hands and or feet are still discolored. They might be blue or purple, and it's absolutely a normal part of transition, and it can last anywhere from 24 to 48 hours. So we give this APGAR score at 1 minute. It can be done right on mom, and we do it again at 5 minutes. It can be done right on mom. Now, if it's below a 7, it is very likely your baby is over at the warmer and needing some resuscitation or some help. And so that's why we have this score so that we know what we need to be doing with baby. So as far as baby goes, after you've given birth, baby is laying on mom and you've likely done the delayed cord clamping. I do want to note here that some people do choose to do what's called cord blood banking. Now, when you look at the research about delayed cord clamping versus cord blood banking, there are way more benefits to the baby for delayed cord clamping. However, if you have some family issues, genetic possibly, or other things, you may really want to consider cord blood banking. Cord blood banking needs to be planned before you even go into labor. So start looking into that now and decide if that's something you want, because the company that you're going to bank with will send you a kit, and that kit has to be taken with you to the hospital so that the nurses can draw blood on you and they can draw up the cord blood after delivery. So cord blood banking is definitely an option, and it is really beneficial for some people. So check into that and see what you think. If not, you've done delayed cord clamping and baby's on you. So what is this baby going to look like? Let's talk about that. So babies can look really funny looking when they've been delivered. And the reason for that is because their head just had to form and shift and mold to get through the birth canal, right? So with a newborn, we have these soft spots, okay? This is called the posterior fontanelle. And then there's one here on the top of the baby's head, and this is called the anterior or front fontanelle. And then if you notice these suture lines that are going right there, there's some here, there's right here. These suture lines are what allow the baby's head to actually like form and mold. And that's when a baby has like a cone head shaped appearance. So the awesome thing about these cone head babies is it is so amazing how quickly it resolves. So I do encourage you to take pictures of your newborn, every few hours or so, and you'll be able to see the transformation of how that just goes right back to where it's supposed to be. It is such a wonderful thing that nature allows our babies' heads to do that. So a cone head is not uncommon. There may be some swelling on the baby's head too, okay? We could call that caput, or sometimes they could even get what's called a cephalohematoma underneath the scalp here, and that's like a blood clot that's forming. And so we really watch how the baby is handling everything. Those things are more likely if you've had a long labor or a vacuum extraction possibly. Some babies are born with vernix. Now, vernix is this white, creamy substance that has been covering your newborn while they're in the amniotic fluid, right? They're floating around in that fluid and they've got this thick, lotiony white stuff on them. Some people say it's like cottage cheese. Other people say it's like cream cheese. I have to agree with the cream cheese analogy. And so after your baby is born and placed on you, they'll get dried off, but we don't want to rub the vernix off. We want to rub it in and just let it be, because it's a really great skin protectant for the newborn. And if you get it on you, mom or dad, or whoever gets it on them, it's not a bad thing. It's like nature's best lotion. So you just rub it in, okay? And not all babies will have this. The closer you are to 40 weeks or beyond, the less and less likelihood your baby will have vernix. So sometimes we'll see babies come in and, mom's saying she's being induced to be 42 weeks and baby is chock covered with vernix. It's like, her estimated due date was not quite an accurate estimate. Another thing with babies that are born past their due date, they could have wrinkly skin and peeling, like lots of peeling. This is very normal, and it does not require you to put lotion on, okay? As a matter of fact, lotion is not recommended for newborns. It's got chemicals in it, and their skin is still being protected by the amniotic fluid and any vernix that was there. So please stay away from lotions and harsh soaps. As a matter of fact, I highly recommend that you check out EWG. That stands for Environmental Working Group. And what they do is they combine a bunch of products that are non-toxic for you, your newborn, your household. And that's really important because a lot of the products on the shelves nowadays have a lot of chemicals in them. And in those chemicals are what's called endocrine disruptors, meaning they really mess with your hormones. So sometimes if I'm looking for something new, like when I ran out of shampoo, I typed in shampoo EWG certified in the search bar, and I found some shampoos that I was able to use that actually worked pretty great for my hair. So finding something that's a good replacement for an item you've always used is tricky. But when you start out with your newborn, please, I highly recommend that you find things that are non-toxic. Things like Johnson & Johnson's shampoo, and those things are very toxic. So please try to steer clear from those. It's hard because they smell really good. If you really, really, really love the smell of the baby lotion and it's not great for your baby, put it on your hands and put it on maybe the baby blanket or something so that you still can have the smell, but it's not seeping in and being absorbed through your baby's skin, okay? It's best to steer clear of them altogether, but sometimes we kind of can't resist the smell. Now, sometimes babies have other things happening to them and they look a little funny. So let's talk about some of the most common appearances that you'll see with newborns. Besides the cone-shaped head, you might see bruising or lacerations from the scalp electrode or the vacuum or forceps. Now, I don't see forceps used hardly ever anymore. As a matter of fact, it's probably been about 10 years since I've seen them. None of the facilities I have worked in recently have used them. So other things that the baby could have, they could have this. This is called a Mongolian spot. And this is normally on the buttocks or the sacral area of the back, but it can also be on the legs and the arms as well. These darker spots are very common with darker babies, and they will generally fade as the baby's skin tone starts to darken. These start to fade and become less noticeable and almost entirely disappear for most babies. This is called milia. Now, milia is little white spots that can be usually on the baby's nose, cheeks, and sometimes a little other places as well. And it kind of looks like clogged pores. We don't need to do anything about this. This is completely normal and we just let it be. Some babies will have birthmarks at birth as well. And then others might have the stork bites. And this is what the stork bites look like. The stork bites will generally fade and disappear within 18 months or so. So let's talk about bathing because we're right here anyway, talking about skincare. Most hospitals nowadays will not bathe a baby until 24 hours or later. And there are some that still do it, unfortunately. But the reason we wait for the hair washing or the bath is because it can mess with the baby's regulation of their temperature. So thermoregulation. And so it can make their temperature drop. We don't want to do that. It can also have an impact on their blood sugar because of the stress of their temperature. So we don't want to stress them out. Plus, there you've got that protectant, right, of the vernix and the amniotic fluid. We want to just let that be. Now, at the 24-hour mark, if you're in the hospital and you want your baby bathed, you can ask them to find out what kind of products they're using. And a lot of people will wait until the cord falls off. So what they'll do is they'll maybe wash the baby's hair at the 24-hour mark and use just water on a washcloth to wipe any parts that need to be washed, right? Like, the bum, or if the hands need to be washed, do that at that point in time, and then wait for a full bath once the baby hits 2 weeks. So you would keep clean the baby's face, any, milk that might get in here. So you're cleaning them, you're just not doing the full bath procedure. When I work with home birthing moms, it was very common to wash the hair after the 24-hour mark with some extremely mild soap or sometimes just water, and then to wait until the baby cord fell off to submerge the baby. It is okay to submerge the baby even if the cord is still intact. As a matter of fact, this is called immersion bathing, and it is recommended for thermoregulation. So you can bathe the baby in the water with very mild non-toxic soap, and then just make sure you dry the cord really well after the baby has been moved out of the tub. And there are a few different methods of bathing a newborn. I prefer the immersion. I feel like it's less stressful on them and it causes less issues with their temperature. Some people will go ahead and put the baby like in a baby towel and place them in the water in the towel, and then slowly open the towel and, wipe the baby down really gently. Now, we got to be very gentle. Their skin is very gentle, and we don't want to be, using a lot of friction or anything like that. They don't need to be exfoliated, right? This is a common newborn rash, and we actually call it the newborn rash. It scares a lot of parents. It'll normally show up about the 24-hour mark or so, and it just looks red and irritated and painful, but it is very common, and there is nothing that we do to treat it, and it will resolve on its own, okay? So just be aware that this could possibly happen, and it's okay. Baby acne is a thing that some babies have to deal with. And my encouragement to you is to stay away from lotions. Make sure you wash the baby with either very mild non-toxic soap, and then rinse, or just use water with the washcloth when you're washing the baby's face. And you could always use a little bit of breast milk on that baby acne to help clear it as well. Breast milk's really an all-purpose tool. It has antibacterial qualities, antifungal, antiviral qualities, so you can use it on the baby. Some people are like, well, my baby has milk all over their face from breastfeeding. And I get that, and it's fine. But if the baby's using their mouth and they're breastfeeding, and then they're getting their, face full of milk that way, that's also likely combined with maybe some dirt or some germs or something. So if you wipe the baby's face really clean with just water, and then you express clean milk into a spoon or syringe or cup, and then put that milk with clean hands on the baby's acne, it almost always clears it up within a day or two.